Hello YouTube. On December 12th of 2019, I had XLIF surgery done. This is my journey, why I had it, and subsequent videos will give you an update 1 week out, 2 weeks out, and 1 month out. It's been a month, a little bit over a month since I had the surgery, and I've been taking very accurate notes, so this is a very accurate account of what I went through. And hopefully, if you're thinking about the surgery or going to do the surgery, this will help in some way or another. So anyway, why the surgery? For years, I've been having a bad back. I've always had this gnawing feeling right around my L4, L5 level. And it felt like something trying to get out of my body or trying to like mold into my body. And it was always bothering me. In addition to that, anytime I strain my back, it gets severely stiff, to the point where it felt like tightly wound rubber bands, that if there was one sudden move or even a subtle move, that one of the rubber bands would have broken and subsequently caused my back to give out. So that thing kind of did happen a few times throughout the years. But for this particular case, the first injury occurred on March 14th of 2019. It was a very busy year for me. I have a very labor-intensive job. And throughout 2019, I kept getting reoccurring injuries, and I never had time really to recover from any of those injuries. So going back to March, things just started getting a little worse month by month, day by day, however you want to measure it. Until the point of September, about the third week of September, I had to leave work. It got to the point where anytime I bent forward and did some sort of work, even 5 minutes long, maybe 20 minutes long, whatever it may be, I'd probably get stuck in that position. Or if I didn't get stuck, it'd be really, really sore. And when I woke up the next morning, my back would be severely, severely stiff, to the point where I felt like a Frankenstein, where I couldn't turn, I couldn't twist my trunk, anything. Otherwise, my back would have gave out. From March, I started getting pain in my hip. It started off with maybe just a little shooting pain around my hip area. And then by the time September came down, the shooting pain was going all the way down the outside of my legs, more so on my right than my left. And while I was waiting for the surgery, the shooting pain down the side of my legs actually went to my foot. So I had a burning sensation in my foot also. That actually happened one night when I was going to bed, and I thought my foot was on fire. I couldn't sleep all night. I actually had to put an ice pack on to relieve some of the heat on it. If you physically felt my foot, there was nothing wrong. It was the same temperature as the rest of my body. But I guess all those nerves firing up caused my foot to have that burning pain in it. So besides the gnawing pain by the L4, L5 level, there was also this general pain from below, a little bit below my scapula, all the way down to my lower butt. That's how it originally started. And then it started spreading further down my legs, outside into my foot. So that's the journey why I got to that point. So while I was going through all of this, I tried, because I've been hurt in the back, I did some of my back physical therapy exercises that I'd done in the past, but nothing really seemed to work. I was doing yoga to help stretch out my muscles, hopefully, loosen it up and make it feel better, but that didn't work either. I had to stop walking because my shooting pain in my hips was so severe that I couldn't walk anymore. Just stepping off a curb or stepping onto a curb, which was like 6 inches high, would cause that shooting pain. I'd have to stop and rest for a few minutes and then continue on to my walk to get back home. The only thing that didn't bother me was swimming. So I began swimming in my neighborhood pool, and that was a really, really good workout, a whole body workout. And I think it helped me in my recovery, which I'm going through right now, because I was actually a little bit physically stronger. I was doing some sort of exercises. I wasn't just lying around feeling sorry for myself and having a harder time to recover after the surgery. So I finally met with a neurosurgeon, and you have to do all the interventions prior to him even considering surgery. So the first thing was physical therapy. I did that for about a month. It did help me maybe get a little bit stronger, but the pain was always there. It didn't get any better. I still had that real gnawing pain. I still had that shooting pain on the side of my hip. And while I was doing the physical therapy, it eventually got to my hip area. I had to do, you have to do at least 2 rounds of epidural shots. I did 1 round. It actually made my symptoms worse. It caused new symptoms for me, and it also made me physically sick. For a couple of days I was throwing up throughout the day. I think something, maybe the dye or something in the epidural shot when they're putting the needle in you made me sick. At least that's what the doctor thought that actually did it, because he had asked me if I was allergic to shellfish, which I'm not, but somehow it must have affected me. So I went back to the neurosurgeon and I told him I can't do any more epidural shots. This thing is making everything worse. It's making me feel sick. So when I went to him, I already had the MRIs done. With that first MRI set that I had done, he saw that prior to me going to the epidural shot and said maybe I had a chance of doing just a discectomy. In that case, I'd probably get back to work in 6 to 8 weeks. He just cut away part of the disc and stay away from my roots or nerve roots in the coming out of my spine. However, when I went back after the epidural shots, I had to do more x-rays in bending forward, bending back, bending sideways positions. And it was discovered at this time that I had spondylolisthesis, where my L4 was actually moving over my L5 and I was pushing the disc back into the nerve roots. And not only was it pushing the disc back, my disc was already bad. It was a little bit bulging at that point anyway. So from a discectomy, it was decided that I'd have to do a spinal fusion, thus the XLIF. So hopefully I'll have my other videos up real soon, and you can follow those in my surgery and recovery periods all the way up to 1 month out. And then hopefully after that, I can keep doing updates for you maybe every month or every 2 months. All right, good luck with your surgery.